Skin lesion condition video. Purpura. Examination room.
Hi, good morning, Mrs. Dow. Welcome to the dermatology clinic. How are you doing today?
Good morning, I'm doing fine.
Could you confirm your date of birth, please?
November 3rd, 1980.
Thank you. I'm Dr. Bunbury and I'll be your dermatologist today. So what brings you in?
I'm concerned because I've noticed that purplish spots have appeared on the skin of my lower leg.
Do you have any idea of what may have caused it or when it started?
I noticed last week, but it never went away. I don't know how I got there, but I noticed that my menstrual periods have been slightly heavier than usual and there is slight blood in my urine.
I see. I'm going to ask you a little bit about your history to help me get a better understanding of your current health. Is that okay?
Yes, that's fine.
Can you tell me about any significant illnesses, surgeries, or hospitalizations you've had in the past?
I've had leukemia in 2023 and I got a stem cell transplant too.
Have you had any issues since then? Are you taking any medications?
No, I haven't had any issues, nor am I currently on any medications.
And have there been any major medical conditions in your immediate family, such as parents, siblings, or children?
My father had leukemia in the past and my mom currently has stage 1 hypertension.
Can you tell me a little bit about your current habits and lifestyle? For example, smoking or drinking habits or exercise activity?
I used to be a heavy smoker back in 2015, but I quit. I have never drank before. I also try to go on a morning jog every day.
I see. Thank you for that information. Now that I have your background on what is going on, I would like to do a physical exam. May I take a look at your legs?
Be my guest.
Okay, I'm gonna hand sanitize and put on some gloves. Okay. I'm going to feel around this area. Let me know if you feel any discomfort.
Okay.
I see why you feel concerned. Did you feel any pain when I touched your leg?
No, it doesn't bother me. It doesn't feel like anything severe. It just looks concerning.
Does that change depending on the time of day or season? Does anything make it feel worse? Let me take a look again. Based on your physical examination of your leg, these small purplish red spots tell me that you may have something called purpura. These spots do not blanch or turn white when I press on them, which also leads me to believe that it is purpura and not some other type of rash.
Oh no.
But don't worry, usually purpura is nothing scary. Okay, so now I'm going to run a couple of tests so that we can confirm if this is in fact purpura. If that's fine with you.
Okay, that's fine.
Okay, so we're going to take a complete blood count and a urine analysis. It shouldn't take too long, no longer than 20 minutes. Have any questions or concerns?
Not at the moment.
Okay, I will be right back.
Complete blood count and urinalysis. Tests are ordered and completed. Dr. Bunbury returns.
Hi, Mrs. Dow. The tests have completed and the results are ready. They confirmed mild thrombocytopenic purpura, or ITP. Your CBC test revealed a low platelet count, which is a direct symptom of ITP. The urine analysis also revealed a small amount of blood in your urine, which is also a sign of purpura.
Oh no, is that serious? Should I be concerned?
Fortunately, since your case is mild, I will send you home and ask you to monitor for any changes for 7 days, as your symptoms may resolve on their own.
And if they don't?
If you see no significant sign of improvement, please come back for another visit, and we'll get you started on further treatment.
Oh, okay. What treatment is it?
There's this medication called prednisone, which will help raise your platelet count and reduce bruising and bleeding. We could probably start you with 5 milligrams orally once per day for 14 days and monitor if there is satisfactory improvement, in the case it doesn't get better.
Ah, I see. Thank you.
Okay, Mrs. Dow, here's a little informational poster on purpura to give you a better idea of what you have. Here we have some 3D models as well.
Wow. This is really helpful. Thank you.
You're welcome.
Wow.
The typical size of purpura is between 3 millimeters to 10 millimeters in diameter. It can appear in various patterns, often related to their cause. It can be clustered, generalized, or branching out. For elevation, it can be flat or macular, or there is also raised palpable purpura. For the color, it can be red, purple, or brown spots on the skin, or some sort of combination of this color. The lesion does not blanch or fade in color when pressure is applied. For location, it can occur anywhere on the body. It is common on the forearms, hands, and legs. The shape usually consists of smaller dots that cluster in a specific area, but it may appear as one larger patch. It is highly variable and usually irregularly shaped. For consistency, it depends on underlying medical cause. It is typically non-palpable, soft and flat, but there is also palpable purpura, which is firm and elevated. The border is irregular and variable and may be sharp or branched out.
Okay, so that wraps things up. I'll see you at your next appointment if needed.
Okay, thank you, Doc.
No problem. Thank you for coming in today. Take care. Bye.
End.